Welcome, everybody, to another great episode of Real Life Matters. I'm your host, DBoss. I'm bringing you all the entertainment and the entertainment while everybody's at home or if you're around and stuff like that. But today, I have a very special guest, and he has an up-to-date facility that specializes in kinetics correction, physio, and he deals with the body. And he's going to be talking to us today about what you could do, home-based therapy. And, because everybody's at home with COVID, people probably not sitting right. They're eating all types of snacks and, they're just getting out of shape and they're just saying, oh, well, I don't know what to do, so I'm at home. So we're here with a special somebody, and we're going to find out who is that person that's going to help us today get mobile, even while we're at home, not mobile. So he's going to tell us. So with no other further ado, I introduce to you Andrew Candido, the clinical director owner of KineticCarePhysiotherapy.
Hi everyone, how's everyone doing today?
We got Andrew, boy.
Ready to rock.
Boy, and Andrew has a Caribbean background, a little bit of both. So tell everybody where you come from.
My mom is from Guyana, South America. My dad is Sicilian, so I get a lot of good food, a lot of fresh vegetables and wholesome meals to help complement the body and attack that inflammation that we are developing from being sedentary, right? That olive oil and the turmeric that we have in our curry works hand in hand, right? You get the
yes. I love curry. I love it. I love curry. We like all the foods, but you just got to be careful how much you eat of what type of food, right? Especially when you're coming from the West Indies, you got a lot of those sweet goods and.
That's right. It's a balance, a perfect balance. Get the sweet from the sour sap if you can. Get it from the cane. Get it from the sugar cane if you can.
Well, I thought that the sour sap was good for nerves.
Yeah, cancer too. Antioxidant, very powerful. Yeah, wow. They have food basics right now. They have the little container. We mix it with a little bit of milk and blend it with ice, so you can have a little bit of that Caribbean flavor.
Well, I got to go over there and stop and see if we can get it. Well, of course, you got to line up first to get in, and then line up to pay for it.
That's right.
All right. So, Andrew, I want to know. Okay, your facility. What makes your facility different from everybody else's facility? What you do?
I'll say in most cases, when it comes to facilities in general, it's mainly the people who work in the facility, but also the structure of the facility. So one, you take experience, you take individuals who love the job and the line of work, like our frontline health workers who are dealing with the pandemic and people who have symptoms right now. Our nurses, we have to hand it to them. Paramedics, you're born for this. If it's your calling, you're sticking to it. And I've been doing this for over 20 years now. With that being said, the health professionals that you work with, the experience that they have with working with people, super important, right? As opposed to new graduates, they're great when it comes to theory, but they don't have the practical experience of dealing with different conditions and adapting to different people's body, environmental factors, their type of stress. Everybody's different and unique in their own way. And what makes physiotherapy or osteopathy, my background's in osteopathy, kinesiology, physiotherapy has been done. There's different forms of physiotherapy, but mainly active rehabilitation for myself. The structure and the open concept ability for me to treat somebody passively and actively at the same time. It's within a footstep. So having accessibility to the right modality, which is a therapeutic application of being able to use ultrasound as a therapy, interferential current or electrical therapy is available, heat, ice, shockwave therapy, traction as a therapy. Those devices and the investment that's made by facilities go a longer way than ones that don't have those that availability of modality.
So you have all those things at your clinical facility right now.
Correct. And this is like my small gym area, which is intimate, perfect. It's cozy. We vibe with the right music, soca, Caribbean music, reggae. We always pick it up a notch to keep people motivated and happy. We want to release the endorphins, right? Get the 80s music going to get people nostalgically thinking back to when they were at the fittest point of their life, right?
Wow. Everybody was like that. So so can you walk us through some steps of like, okay, what's when people first come to your facility, like just take us through a little bit of that. When they come there, what do you do? You have an evaluation, or so people would understand.
So our intake process starts off hands down, no matter where you go today, you want to be able to have people fill out their COVID questionnaire prior to. So the software and the booking system where you can see practitioner availability and go through your screening prior to coming in, the facility is disinfected, it's clean. There isn't an overlap of booking. So when you walk in, there's not like 6 or 7 people all in one facility at the same time. Hand in hand is a priority at today's day and age of where we are with the pandemic. When it comes to our intake process, I examine functionally. I do a screen of everyone. I find out what their therapeutic goals are and what their fitness goals are. I need to know, what's your sport, Darlita? I'm looking, Darlita, are you a tennis player? Darlita, are you a soccer player? What's your passion? Do you like playing pickleball, tennis, table tennis? If you're a sports Jatoni user, like what is, are you a swimmer? So we try to figure out what is it that you're doing in terms of sport, generalized sport, or sport specific, or maybe you're just sedentary at home working behind the desk and you're starting to develop roundedness in the shoulder joint, neck pain. We screen for the underlying problem, or more or less the chief complaint. If there's a chief complaint, it would be like neck pain, and the underlying issue would be, is it reoccurring, and is it due to you being on a laptop for 8 hours a day with improper ergonomics? And if that's the case, we'll look at your ergonomics and reassess your ergonomics to see exactly what you have at home or what can be available to you, like a better chair, for instance, or an obus form, seat back cushion, stand for your laptop so that you're more in line at 90 degrees and eye level with the screen like I am right now.
Okay, well, that's important for people to understand that. So so I know that people come to you usually if they have something tragic, a tragedy has happened to them. They were in a car accident or something like that. So other than that, you deal with people outside of that realm because, because of course you're going to know from what the doctors send, then they come to you, correct?
Yeah, so if you're looking for preventative health, weight control, it could be, hey, Andrew, I want to change my posture. Can you help me to correct my posture? That's something that I would do, because people sometimes they notice in the mirror or their height, they're shrinking. So they're like, okay, how do I bring my shoulders back? What can I do to open up this joint because I'm restricted? Why is it that my left arm has more range in comparison to my right arm?
Oh.
Tons of great testimonials you can check out on our Instagram right now. People who have increased range of motion, manage their lifestyle. And my approach is more lifestyle medicine as opposed to working with people saying, oh, this is what you need to do. It's one-on-one. And I'm making sure that you're accountable to doing things at home, sending you videos of exercises that need to be done on a daily basis. So there is an accountability factor. I look at food, I look at diet, I look at all the different stress factors that can contribute to, as an example, neck, shoulder, back, knee, foot, ankle pain. I integrate myself with a chiropractor, massage therapist, acupuncturist, a foot doctor who's a podiatrist. We do foot and foot care, as well as all the different orthopedic supplies, home health care. So it's a broad spectrum of what I cover under one facility and one roof. So
you're trying to say that the taller people will start to shrink if they don't use their posture? I don't want to shrink at my height. I don't want to.
Generation will take its course for all of us in due time. The secret is to slow down the degenerative process. So as we get older, what will end up happening is the disc space in the spine will start to narrow. Okay, so that spongy cushion that we have in between our vertebra will eventually become a little bit less and less, and that cartilage will start to wear. So I encourage people to slow down the degenerative process, right, by keeping our disc healthy is by moving our disc, moving our spine, loading our spine, being able to overhead to avoid conditions like a disc herniation, any type of impingement on the nerve itself. If you look here, you can see the space is nice and healthy.
Yeah.
This red disc, if the musculature supporting the spine is not fully stable and we don't have what is known as core stability or spinal stability, we're susceptible to herniation and back pain. Okay. So it's important to move. Motion is lotion. I say that to all.
Is that why you see some people, they're walking, that like when they're older, they're humped over and they can't, or is that something different?
Well, no, that's a spine going through its own degenerative changes and gravity is pulling us forward. That's known as a kyphotic curvature or a rounded C posture. Sometimes you can even see it in sport with some guys who in their golf swing or right? You want to be able to extend and have the ability to extend the mid-back, have that extension and maintain that.
I guess if people were playing sports like basketball, football, or tennis, I guess because you're always down, you got to move forward. I guess that mobility. Well, I played basketball and played tennis and stuff, so I'm just like, wow. I'm just wondering now if I did my own damage to my own body from that.
What ends up happening is your body will the way you move your body is the way you shape your body. So if I'm a racket sport player and I'm not doing functional based exercise to correct my posture by rowing, pulling back, keeping my shoulder blades, learning to retract my shoulder blades and always have them rounded. If I'm at a computer, I'm rounding my shoulder blades. The more I round my shoulder blades, the more my shoulder starts to look like it's rounded. The way you move your body is the way you shape. You stay in the same position without movement and you're more static, you're going to end up looking like more rounded, right? So our spine is shaped like an S. We want to maintain the curvature in our neck, which is also known as lordosis, and the curvature in our back, our lower back, which is also known as lumbar lordosis, right?
Well, so as you know, because you say you know, a lot of people think, oh, I don't want to bring my child or my kids to get this get the process done or anything. So so for kids, if kids do this early on, they can prevent stuff or prevent that?
Absolutely. So I work with a lot of children in the past and presently, coach children's basketball. So refer children to me. I have a client right now who's referred her son in, and he just loves coming here. He doesn't want to leave. I have him interacting with me, learning to catch a ball one-on-one, and this can be covered through extended healthcare to be able to develop the sensory awareness called proprioception, so that people can learn to be more aware in sport or aware, as an example, if you're older, to avoid a slip and fall. We do that by training for balance. We do it by training for stability, and we do it for training for mobility. For instance, in the ankle, right? The ankle joint. Sometimes a joint can be hypomobile, lacking mobility, or hypermobile and lacking stability. So we look for those indications so that we can work up the kinetic chain. You did mention kinetic. Kinetics means movement. How well do we move? So going back to the intake process of anybody who comes in to see us in the beginning, we look at how do you move? Can you squat with incorporating what we know as the posterior kinetic chain, or are you anterior? When you squat, do you come up onto your tippy toes, right? As an example.
All right. So you were just saying that, okay, well, you say you coach basketball, and when one of the clients came in there and they actually were, you said that you taught them how to catch a ball. So So in basketball, when we're catching a ball, is something we must be doing something wrong.
Yeah, well, he's 5 years old, and you'd be surprised that people are hesitant when something's coming at them at such a young age. What do you do when a ball is being bounced and it's coming at you? The sooner you learn, the sooner you develop these skills, the faster you can apply them to sport. And I highly encourage us to look at, what is my sport? What is my passion? Do I enjoy bike riding? Do I enjoy swimming? In all parts of the world, you can go to a beach and find some water, get back into swimming. Aquatherapy is fantastic for arthritic patients, patients who have joint pain, muscle pain, stiffness. Just stay in shallow water and allow your joints to move. Find your sport, stick to your sport to the very end. Golf is a great sport. You can play it to the very end of time as well, you know.
A lot of people say, I know it's a sport, but a lot of people just say they do the golfing just to go out there to meet meetings and stuff. So
yeah, it's a social sport. It's lengthy. It is lengthy, but it can be enjoyable and fun if you understand the body mechanics and you allow your body to sequentially move into the pattern of being able to hit that little ball straight ahead. And, you know, you get to enjoy the outdoors and get some fitness and movement into the body.
Oh, okay. Well, we're just going to watch a brief moment here before we get into the actual topic of you like to use a lot of the loops. Yes, that's what he was holding his hand, people, for people that are looking and wondering, well, what's Andrew fiddling with?
Well, yeah, so this is a fitness loop, or it's a TheraBand. It's an elastic band that we use in therapy. Some people know that these bands here, known as a TheraBand or an elastic band, you see them, you can find them at like your local dollar store. Will carry something like this, or any fitness store. Any rehab facility will have different colors of band. Typically, the lighter the color, the least resistance, and the darker the color, the heavier resistance.
Wow. Well, that's an interesting thing, because you would just think I like the purple one or the yellow one, or you just buy that color.
So yellow would be the lighter resistance.
Andrew too.
Yeah, right on. So, and this one here is a fitness loop. So you have the exact same band.
Okay.
And the medium resistance that you can, you know, with one arm hold on to and create your own row for your shoulder. So a lot of people have rounded shoulders. By creating a resistance with the opposite arm, you get a contraction in my left arm and shoulder, but I'm also pulling back, allowing a nice light resistance for my own seated row. This can also be placed on your foot. I'm just going to move to my screen here so you guys can all see it as a row. So you can do a bent over row.
Wow.
Right? Like you're starting a lawnmower, or just incorporating upper back strength and the bent over.
That's for your upper back strength, to do that little exercise.
Yeah. Yes.
Okay, so now we learned something about the loops. That people just don't go out there and buy your own loops because you like the color. You have to get the loops according to the resistancy. So the black loop is the most resistant.
That's right. You have the heavier resistance. It's good to have a variety of colors based on your fitness level. It's important to have a variety where you can start off you can superset by starting off with a heavier resistance and then continuing into a lighter resistance to fully utilize the energy in the muscle so that you can build strength and build muscle and maintain what we have as muscle as well.
So when you do this, so you would tell people, okay, what strength they could use? Would you advise the patients or the client, you know, you could go to this strength.
Right.
Some people go there and hurt themselves.
I look at active rehabilitation. If I'm correcting a shoulder, or if I'm correcting, like even for the wrist, if I have wrist pain, I can rotate, supinate, pronate, flex, and extend my wrist. Mm-hmm. Or if I have elbow pain, I can flex my arm and, you know, tuck the loop into under my foot, or just hold it with the opposite arm. By using bands have a resistance they're good for eccentrically loading. So when you use a band, typically when you come back, you feel the resistance coming back. So this is how you gain muscle strength. is by coming back down slow, the eccentric aspect of the movement.
Okay, so it's not so much pulling it, it's what you do when you come back, when you release it.
Exactly. So maximizing on muscle tone and maintaining muscle tone while using the bands is highly effective, inexpensive, can travel with it. You don't need any space for it. You can tuck it in a drawer, put it in a Ziploc, and you can do a full body workout.
Just from those bands alone?
Just from those bands. Typically with people who have lower back pain, a lot of the times they have lower back pain because they're weak in the glute medius, which is the side of the hip. So I will get people to take the band, put it on their feet, and just walk laterally.
Oh.
Right? So
do you feel exercise. You feel it? You feel it, the pull when you're doing it, or no? When you're actually doing that side motion,
definitely feel.
Just do it again, so
the burning sensation in the side.
Okay.
Yeah. So just kind of take your time and walk laterally by maintaining strong core and continuing a light movement laterally. But remember what we said, when we come back, we're going to take our time, and slow and steady wins the race.
Okay, it's slow. Okay, so not so much the pulling out, it's the coming in. So
that's
people
right.
hope you pay attention to that, because that's what, that's what's going to work.
Yeah.
Because a lot of people probably think it's the pulling out. It's that.
Yeah, exactly. We just feel like, we just need to lift. We got to come back slowly to the starting point.
Well, we're
great exercise. I highly recommend doing that one hip. Yeah, go ahead.
Okay. Well, do you want to take a look at the short video? Yeah, let's watch it, and then you could go into it.
Yeah, okay, sure. Go ahead.
All right, no problem.
All right. Bikini season is around the corner, and the reality is most of you don't want to show up at a gym every day. So we decided to bring you an anywhere workout, which means you can do it anywhere. Andrew?
Absolutely, Mina. With these fitness loops, these mini bands are great. We use them in rehab, we use them in fitness.
The inexpensive resistance bands can run anywhere from $4 to $9 a piece and come in several colors.
The lighter the color, the least resistance. This would be your starter band. This would be your band for pretty much increasing more repetitions, higher endurance. So we're going to start off with a movement that's going to incorporate strength, stability, and balance.
Okay, so I'll take this as medium.
That's a medium resistance. I'm going to do the heavy resistance. And we're going to start off by coming out and abducting the hip, flexing the hip.
I can barely move it.
And then extending the hip. So we're just standing on one foot and incorporating just 10 repetitions, as easy as that, will help to decrease that adipose tissue, develop balance and stability on the opposite side. Brought the band up the kinetic chain. We want to be able to incorporate a little bit of a pelvic tilt, right? And we're going to move forward with a small contraction that's controlled. The way we move our body is the way we shape our body.
This monster walk is cardio and strength training rolled into one.
Can you see the sweat? How do you get rid of the batwing arms?
It's a common question, but very simple. The band will allow us to incorporate an eccentric contraction. So all you have to do is hold the band like we're doing right now, and we're going to just extend the arm. And what you want to do is come up with a nice slow and controlled resistance. See how I get that shake coming back up because it's nice and slow and controlled, just like that.
This version of the bent over row takes up little space and can be done anywhere. Time to get down and work on those beach body abs.
So in the plank, you're going to basically take your knees and come up to the side, just like that. Exhaling, come up into a push-up position. Incorporate the same movement. Stay nice and stable. How's that feel? We can lower the resistance if you like.
I can't talk.
Good job, Mina.
Mina Ree, Global News.
Excellent.
Abs of steel.
Wow. Andrew, why are you trying to do the person, kill the person?
There's different fitness levels, right? And I used to work with her personally, and her and I had a great relationship. So she decided to take what I was doing with her. She couldn't believe that you can get the results and get the intensity and type of workout in from something so simple. It looks so easy.
Well, can you tell us about the pelvic walk? What is that good for?
So that lateral walk that we were demonstrating earlier on, when we assess and evaluate our patients, a lot of us have weakness in the side of our hips. It's difficult to build and maintain strength on the side here. If you're not genetically predisposed to being mesomorphic or having a lot of musculature, and our gas tank for holding on to muscle is not as big as some people are. We're genetically all predisposed to having different body types. So what we try to do and incorporate when you're looking at the pelvis specifically, one is, how is our pelvis moving? So no one has a perfect movement in pelvis. When we walk, we go through nutation and counter nutation. When we're moving, we have rotation in our pelvis. So we check to see, is the pelvis moving in a neutral position, and is it moving freely? Right? If it's not restricted and the pelvis is moving, we can check if someone can actively pelvic tilt. My pelvis is now tilted anteriorly. Now it's tilted posteriorly. So if I go into a sit to stand, I go into my sit in an anterior pelvic tilt, and I stand up in a posterior pelvic tilt. That's maximizing on mobility of the pelvis. It's retraining our body to activate the muscles to achieve muscle balance, so that people understand that my joints, my pelvis is actually moving in this plane. Looking at the band, if we were to simply stand up without any exercise equipment whatsoever, and I were to stand up and just abduct my leg like I was demonstrating in the video, I am building balance and stability on the weight-bearing leg. So my right leg is my weight-bearing leg, and this leg is now contracting and relaxing, and I'm building tone on my left side of that same region of the body, which will also help to support the back, prevent and treat lower back pain.
Wow.
Yeah.
I just, and she was saying in the video that, and thanks for courtesy of that footage. She was saying that the pink, she said it was really hard. Is that a low resistance or?
Red, red is close to black. It's, red, blue, and black are the higher advanced end of intermediate type level of bands. If you're looking at green, orange, yellow, those colors there are more light to medium.
But she said the pink, so she was in the middle.
Yeah, they have different variations of colors. So whatever, if you're looking to come and purchase from me, or if you're going to your health store, whatever you're purchasing, it'll indicate the lightness or the heaviness of the resistance based on the color that's being sold by that manufacturer.
Oh, okay. Because I was looking at her, she was like, "Oh my gosh, that pink is a little bit hard." So I was saying, "Oh my goodness." So how would you know, because now you're saying that the different colors are, reflect, but some people might have the colors might be not, saying what your resistant level at your clinic. So I suggest probably go buy it from you.
Yeah, 100%.
Because it doesn't make any sense, because you might get the wrong resistant level.
Yes, correct. And it's based on the manufacturer. This band here I've used for quite some time, and it just happens to be gray, but this gray band is medium strength. So you can see, if I were to just open it up, it's pretty heavy for something that's medium. But it's something that's small as this, if I were to give you another exercise, opening and closing your wrist, turning your palms in, also opens up the shoulder joint. And people who have rotator cuff issues and not getting enough movement in the shoulder, the band can help in so many ways by even maintaining resistance and coming up nice and slow and back down. You're now stimulating the deltoid, right? Or if you want to work on your pushing exercises, you can hold on to the band and just kind of put it behind you and work on your pectoral muscle, right? So there's movements and exercise programs, videos, printouts, and practical learning from a one-on-one instructor, someone who has a fitness background and has experience in using bands in general, or just using your own body weight. The active rehab prescription needs to be prescribed in phases. Phase 1, when we're starting off, let the body adapt to the movement. Phase 2, that's what I was saying. I'm recommending that you have multiple colors, multiple resistance, so that you can progress. In any exercise program, typically you want to warm up with using bands. If you're starting with a light resistance, you don't really need to be walking on a treadmill for 10 minutes before you're doing an exercise.
Okay.
With a lighter band.
All right. So at least we know, we heard about these loops and bands, but I'm telling you, I guess you don't want, is there any downside? I know because you're going against your own body weight, so that helps you tone more, but is there any downsides to these bands if somebody, because you don't want somebody, can they hurt themselves or?
There's no real contraindications. It's just the quality of movement. How are you moving? If you understand what it is you're doing exactly, right? If you're doing a simple lateral walk and you have back pain and you're going too fast and too far, any type of movement that you incorporate from an exercise or fitness standpoint will always have some form of risk. And this is also a big problem by where people are looking at a video and not having the instructor in front of them to actually correct or fine tune the form, because the form and technique will fine tune and get you better, safer, quicker results. So I highly encourage people to come out to my facility. I'm not wearing a mask right now, but I do have one in my pocket. We do have our temperature check.
We're the authority. So we're coming down to give you a ticket.
Yeah, exactly right.
All right. So, okay. So now we're getting into what you do. What can people do at home now, since they're at home and everybody's just sitting at home?
Okay. So if you're sitting at home, key thing to do is just be aware. Be aware. What do I have that's going to help me to become more aware? Like trigger awareness. It could be a timer on your watch, right? Where you may have a smartwatch or a regular watch, or on your computer, posture check, time to stand up. A lot of these smartwatches will tell you it's time to stand. It'll remind you. I highly also recommend a watch that will allow you to have the functionality and report back to you to kind of let you know, this watch here can check my blood oxygen. It does like an EKG. The new Apple Watch is phenomenal. If you don't have one and you're an Apple user, I highly recommend an Apple Watch. You'll love it. Awareness. So we talk about the timer. Time yourself to have a posture check. Stretching your neck if you can. If you're sitting behind the computer, if you're driving, bringing your ear towards your shoulder and just holding and stretching that upper trap. Sliding our head back on our neck to stimulate neck flexors is also very beneficial. If you're looking at, topicals, if you have pain, a topical spray, there's so many different analgesics or sprays. I tend to use the MediStick Professional. It works really well to kind of take out the soreness, the kinks. It has MSM, glucosamine, chondroitin, boswellia, devil's claw. These are all anti-inflammatory type products.
So what do? You spray it on yourself, or what is it?
Yeah, like in the Caribbean, they more or less looking at working with Vicks, Tiger Balm.
Oh, geez.
Bengay, A535, right?
Bengay. Or they're taking some kind of muscle relaxant or something.
Rather than taking the pill, I'd rather use something topical that's transdermal rather than ingesting something. That's my preference, and that's what I kind of coach my clients on. I also look at a little bit of a roller. If you have a roller or a golf ball or a tennis ball, you can just take that and kind of roll it over your foot, for instance, as an example. You can roll a golf ball over the plantar arch of your foot, just to kind of, if you're experiencing foot pain from not being as active as you were. A lot of people have plantar fasciitis and they get heel pain first thing in the morning. You can even roll over a water bottle at home that's frozen, right? Just kind of roll the contour of the arch. or take the roller yourself and kind of do it yourself, right? You can release those knots and trigger points in your neck.
So just get a ball. So what kind of ball is that? A soft ball or is it just a regular ball?
So I use this. It's called a Harmony roller by Relaxus, and it basically has a roller ball here and a base that you can hold on to. So for all those men and their wives are asking them, "Baby, can you massage me?" It's a little bit easier
than using a hand.
Than using your hands, right? Just grab the roller and incorporate.
So you can purchase that from you also if you have to get that?
Yeah, 100%. Yeah, you can get this from me and we sell them to our clients. So tennis balls, roller balls, acu balls, golf balls, those are all good for rolling out kinks. You can sometimes put the ball on the wall and lean back onto that part of your mid back and kind of roll over it and release it.
Oh my gosh, that must be good.
Yeah.
So just put it on and then you could just kind of move your back.
Yeah, and just roll on it and get that own
well, you gotta send me a couple of them.
yeah, with my pleasure. I'm still waiting for you to come visit me.
I know. So so what like if people now are sitting. So what you're saying is that you do get the watch, you get up every so often. So if you're sitting for like how long? Maybe half hour or so?
Half hour. Like who wants to sit longer than half hour? Sarcopenia is a condition where the muscles become weak and flaccid over time. You're sitting, you're not getting up, you're waiting for your body to feel like you got to go to the bathroom, then you come back and you sit again. You're losing muscle mass, you're losing muscle memory. Let's stand up, incorporate a little bit of like a bunny hop. You can just jump around and stimulate the lymphatic system and get the fluids flowing throughout the body, get your heart rate up a little bit. We can also just stand, provide yourself with a little bit of a tricep stretch by bringing your elbow and touching your mid back, just like this, pulling it back, bringing your arm across the midline of your body is also really good for the back of your shoulder and your rotator cuff. The stabilizers are 4 muscles in the side of the shoulder, right? So this one stretch is very good. The one lateral flexion, very good. Rotation throughout the day. You can do it with your band and just kind of a seated spinal twist.
Wow.
To the mid-thoracic part of the spine. Mobilize and rotate. Going back to sport, like tennis, we need rotation. In golf, we need rotation. In the kitchen, we need rotation, right? When we're moving and cutting and going to the fridge, from going to the fridge to the stove. So we want to be able to incorporate that postural awareness and movement throughout the day. It's very, very important for us to kind of get up, stand up, do what Bob Marley said, and get up and stand up.
Stand up for your rights.
Exactly.
So there's some techniques that you use while you're showering. Can you tell people about those?
So in the shower, we tend to, if you have a heart rate like monitor or a smartwatch, you'll notice that in the shower, your heart rate will elevate, which means that your tissue temperature will also increase, and you're less likely to strain yourself during exercise. And because that temperature is up, it's a good time to maximize on a passive warm-up from having a shower. Because when you're soaping, you're moving your body, you're moving your arms. So it's like a warm-up, right? So you're warming up your shoulders and your arms, you're bending, you're reaching for your legs. So you're warming your body up in the shower. So I say, one of the things I encourage my clients to do, or patients, is to maximize on the temperature of the body being warmer. It's just like being warm for a workout, and provide a couple of movements once you're out of the shower, whether it's just hip thrusting, where you're just, you're in the shower and you get your glutes to contract, or you're out of the shower and you're activating your glutes in your lower body and your core. That's one thing we can do, or just maximizing on some of the stretches that I had incorporated, right?
In the shower that you're doing this.
Yeah, you could do it in or out the shower, because chances are after you get out, we like to lotion our skin with either coconut oil or shea butter, whatever, you're still moving. But while you're doing this, throw in a stretch, right? Keep moving your body, because like I said, the way you move your body is the way you shape your body. So don't forget to maximize on movement. So it's a good indicator and a good way to remember when to incorporate some passive or active assisted stretching and movement when coming out of the shower.
Right. And you were saying off air to me that people can also harm themselves and don't have the right posture when they're cooking.
Oh yeah, scapula, the shoulder blade. So when people who like to stir a pot, the scapula will elevate, depress, it'll rotate, it'll protract and retract. So it has 6 different ranges of motion. One of the things with scapular elevation, even as we type or we're chopping or stirring, we elevate the scapula. Do the same thing in posture check by lowering your scapula and set your shoulder first so that your joint is neutral while performing activities of daily living or working or cooking, right? All of these activities require some form of awareness of posture prior to going into the task, right? So you're preparing yourself, you're preventing injury, you're preventing tension in the neck, you're preventing trigger points from occurring, and you're preventing wear on the tendon itself, right? The stabilizers, because sometimes we don't have the musculature to support the joint. So now the joint is now saying, okay, there's no muscle support, there's no stability. I'm going to start working. The joint is now going to start wearing at itself and start using its ligaments and tendons. And then we have sprains and strains that occur, right? We end up going to the doctor, taking in anti-inflammatories. Sometimes we tear muscles or tear tendons, and it leads to tendinopathy. And we're now looking at potential surgery or rehabilitation, right? So
and what about people, I know it's, maybe it's not off. Maybe I know people probably think in their mind, but they want thing to ask, but I'm going to ask, what about the sexual relations, because some people, they hurt themselves like that too, because they're not flexible. I'm not saying me or anybody, I'm just talking in general. So we just want to know how, I guess if using that band and stuff could help you.
100%. Like you're looking at building strength and endurance goes a long way in physical activity, whether it's sexual. Yeah, I mean, strengthen those hips so you can get some endurance and prevent any aches and pains in your back, right? And your pelvis is moving. We stabilize, strengthen, and we become one with our joints and become more aware. One thing that exercise or active rehab will do is will make you more aware of each joint and each muscle. So the more your body is connected to every joint in your body and every muscle in your body, the less susceptible you are to injury, whether in any physical activity. That's all day.
No, but it's true though, because people probably want to know I can be more flexible. So those bands probably would help, like that pelvic walk and, different things would help them so they don't hurt themselves.
Yeah. And again, like you're right. Like sometimes we get spasms, muscle spasms during different types of activity, whether it's, as you mentioned, or whether it's whether you're working, whatever it is that you're doing. So it's better to have the general fitness. It's better to have incorporate at least 3 to 4 times a week, if not daily. Continue to do light movements, light routine type work to prepare yourself for whatever that you're doing, right?
Well, people are at home, so you got to mention what they're doing at home. So they got to be healthy and they got to be fit and they don't hurt themselves. So, anyways, Andrew, I'm telling you, this is some great tips that we gave us today. You gave, oh my gosh, You know, people got to come. So where can people find you if they want to come and see you, or they call, or do you do over the phone consultations, or?
Yeah, we do virtual as well, like virtual therapy. Right now, we have to become creative. Our software allows for virtual therapy for people who are in car accidents, WSIB, paying through their private insurance or even paying out of pocket. I can coach through camera and video through our system and document and send you tips and follow up with you virtually and have one-on-one sessions. I'm at 3190 Ridgeway. We're inside Core Energy Wellness at the moment, and you know, during these times of a pandemic, the safety precautions are being used. I encourage anybody to give us a call or check us out on our website, KineticCarePhysiotherapy.ca. Don't forget the physiotherapy, so KineticCarePhysiotherapy.ca, or just you know, looking up my name on Google or reaching out to me. I'll be more than happy to help with free consultations, providing hardships for those who can't afford or don't have insurance. I can always do a free consultation and provide as much care and feedback as possible. I do have a passion for what I'm doing, and I love it. It's gratifying.
No, we can see that, and you know, you really like what you're doing, and you know, and also the kids. You know, people that say they don't know what they do. Well, bring the kids or do a virtual with Andrew here and get them healthy. Just don't be sitting at home wondering what I'm going to do or whatever. You go, yes, okay, you may have to pay a little bit, but you know what? At least you're paying for something that's worth it, and it's going to help them in the long run, and also help yourself.
Yeah. Absolutely. Lifestyle medicine lasts forever. And right now we have families that come in like a family, father, daughter, son, mother. They do a class with me 3 times a week. Children, elderly, post-surgical, pre-surgery, you name it. Fitness, body composition, weight loss, it's all done here. I look forward to having you reach out to me, and I look forward to any.
And you do the vitamins too, though. You said the nutrients, the weight loss, right? Stuff.
Yeah. So any like nutrient deficiencies that need to be discussed or supplementation, looking at the essentials of vitamin D, CoQ10, a good fish oil, even enzymes to help digest food are highly recommended. Sometimes even looking into like protein sources, rice protein, pea protein. There's different protein sources that people digest differently and have biochemical reactions in the gut. Maintaining a healthy gut with probiotics and enzymes go a long way, and it's lifestyle changing for many people.
All right. Well, Andrew, it's been great. You gave a lot of information, people. And if you didn't get those information, go back and watch the episode. You know, it'll be on tomorrow.
Yeah,
tomorrow night between 10 to 11.
Keep your immune system strong. Stay hydrated. Get that sleep that you need to get your 7-8 hours of rest every day. And yeah, stay healthy.
All right. Well, everybody, you know, Andrew, thank you. And thank you, know, everybody. He is in his actual facilities right there. So you guys are seeing it, part of it right there behind him. So support him, follow him, call him, you know, if you're watching, you know, and, you know, just, you know, reach out, because there's got people here. Hey, your kids are in basketball. Yeah. Look at Andrew.
Yeah. A lot of places are closed right now, and we're still deemed essential. It's a blessing to be open.
Yes. All right. Well, everybody, thank you, everybody, for tuning in today to Real Life Matters. And, you know, follow me. You can see all the stuff. Follow Andrew. Reach out to him. It's a good person right there. If you're not too sure about what the tips is and how to do the bands, go buy the bands from him. I'm pretty sure you could either pick it up or you could send it to you. So you'll know you're resistant. But also go in or do the virtual consultation. All right. Yeah. So anyways, bye for now.
Thank you. Bye-bye.